lodged in anterocranial fossa. Okay. Now what we are doing? We are cutting this optic nerve and internal carotid artery laterally. Are you following? Are you following? You can see there. You can see the other nerves also there. Other cranial nerves. Okay. Now we are pulling this. Now we are seeing which lobes here? Temporal lobes. These both are temporal lobes lodged in middle cranial fossa. Are you following? Then what we have to do? We have to place our fingers here. We are separating the, here you can see tentorium cerebelli. What you can see here is, this is tentorium cerebelli. We have to cut the tentorium cerebelli along the attached margin. What is the attachment of tentorium cerebelli? It is attached to what? You can see here. Just put your torch here. You can see this is the free margin of tentorium cerebelli. You can see here. Free margin, this is attached margin. So we are going to cut along this margin. Which margin? Superior border of petrous temporal bone. So that we will remove along with what? Along with cerebrum. We are removing cerebrum and cerebellum. Are you understanding here? I am just cutting here. This is tentorium cerebelli. I am separating tentorium cerebelli from which border? Superior border of petrous temporal bone. You can see what you are seeing is cerebellum. What you are seeing, this is cerebellum. And I have cut the attachment of tentorium cerebelli along superior border of petrous temporal bone on the right side. Now we will do the same thing on the left side. Put the focus here. Yes, you can see here. Just hold this. Okay, here you can see. Are you following? So I have cut here. You can see here. Are you following? Now I have cut what? Tentorium cerebelli attachment on the both sides. Now what you see, this is brainstem. Now what you see here is, this is brainstem. You can see basilar, artery and vein. Okay. Okay. Now what we are going to do? Now we are going to cut the spinal cord at foramen magnum. Now what we have done? We have seen the anterocranial fossa, middle cranial fossa and all. Now we are going deep. I am cutting the brain. I am cutting the brain at what? Spinal cord level. Okay, I am passing the, yes, you can see two vertebral arteries there. I am passing the forceps here. And I am cutting across, yes, medulla. Are you following? Now, we can take out the brain. Are you following? Yes. So, this is the cerebrum with the cerebellum. So, tentorium, just hold this. Tentorium cerebelli was here. Are you following? We had cut the attachment. You can see here now. You can notice here. Come that side. You can see this is falx cerebri. These are tentorium cerebelli. This is attached margin. This is free margin. And if you go inside, you can see this is falx cerebelli. On either side, you can see cerebellar fossa. And here you can notice what we have cut here. We have cut the brainstem at the level of junction between spinal cord and medulla oblongata. Spinal cord and medulla oblongata. You can see here. It will be like this. You can see crista galli. You can see crista galli here. You can see crista galli, and you can see this is the anterior narrow margin of falx cerebri. As it goes posterior, it becomes broad and attached to the roof of tentorium cerebelli. Okay, tentorium cerebelli has a free margin and a attached margin. Free margin goes to the anterior clinoid process here. It's a U-shaped notch. Attached margin to the superior border of petrous temporal bone and transverse sulcus. We had cut the tentorium cerebelli at the attachment of superior border of petrous temporal bone, so that we can remove the cerebrum with cerebellum. You can now see superior sagittal sinus. Here will be inferior sagittal sinus. Here will be straight sinus, and these both are transverse sinus. And here you can see occipital sinus. And here you can see cavernous sinus. What we cut here is optic nerve and internal carotid artery. Now just see the dural folds. We have how we have removed here. Just see that. You can see falx cerebri, tentorium cerebelli, Falx cerebelli.